Morning, everyone, and welcome. We are so excited to have you here with us today for the webinar, New Solutions, Medications, Nutrition, and More. If you've missed the others, there are recordings available. We will make sure that you get that link. This webinar is being brought to you by the Maryland Department of Health. I'm Sue Lockenmeyer. I'm your moderator for the day. I'm with the Maryland Living Well Center of Excellence, and our speakers today are Ms. Ann Langley, Dr. Eva Tseng, Dr. Catherine Fiddler, Ms. Susan Cottingen, Ms. Kelly Birch, Ms. Kelly Kessler, and Ms. Leanne Eagle. So you see we have a really full schedule with wonderful information to you. I want to encourage you to submit questions in the Q&A tab throughout the presentation. We will have time at the end for questions. Also, if you have stories, your own experiences to share, we will open up those lines. You can go in as a participant, click on your name, raise your hand, and we'll be able to unmute you so that you can provide comments and tell us what's going on in your lives. So we're going to start this morning with Ann Langley. She is the director of the Center for Population Health Initiatives at the Department of Health. In this role, she's assisting all of Maryland to achieve specific population health improvement goals with an initial emphasis on diabetes. Prior to joining the Department of Health, Ann served as the Senior Director of Health Planning and Community Engagement at Johns Hopkins Medicine. Ann, take it away.
Thank you, Sue. And thank you for attending today. This is the last of 8 webinars that has been sort of a whirlwind the last couple of weeks here in September. All 8, as Sue mentioned, will have been or will be posted online, and we intend for them to be accessible anytime for at least several months. So I'll encourage you to come back, or you can tell other people. Just happy for anybody to access the information. I really plead with you to complete the post-webinar survey. This is really the first major activity of the Center for Population Health Initiatives, which started last February. And we have much more to do over the next 5 years. And we really appreciate any input that will help us provide what's helpful to you. And since it's the last one, I really want to thank Maryland Living Well Center of Excellence. They've done a tremendous job in a very short period of time. And we look forward to continuing to work with them as partners. So I noticed today, we've given an introduction at most of these, and the topic of my introduction today is improving the lives of people with diabetes. Which is great. It's really what we're trying to do with everything that I'm doing in my role, is improving health, which we think improves people's lives. So I'm just this is gonna be very brief, and some of it's kind of a recap of the last 8 webinars. So next slide. Or do I have those? There we go. We use this slide a lot. We think it's really important that everyone understand the scope of the impact of diabetes on the citizens of Maryland. We estimate about 2.1 million people, adults in Maryland, have diabetes or pre-diabetes. That's about 1/3 of the population of the state. So it's a really big impact. Next slide. This is a slide with a link to the Maryland Diabetes Action Plan. The action plan was produced over the summer, mostly, of 2019 and released last fall. It's a great resource. It's packed with data and tables looking at diabetes and the different populations it impacts and how looks at some disparities by race, education, income, and it, I think even more importantly, it really lays out a plan of action for different groups to sort of take their role in improving the lives of people with diabetes and reducing the impact of diabetes. So I encourage you to check that out. Next slide. So as I was saying, the plan really points to a wide range of partners, starting with you all, with patients and family members. You're at the center of this. You're a critical partner as we go through all our different activities. Clinicians, members of the provider community, they are all actively engaged. You know, obviously, some very experienced. We have some today very experienced in helping people manage diabetes, but there's a lot more work to be done, a lot more improvement in quality and outreach and connecting people, making sure clinicians have the support of all of the others who can help them, nutritionists, dietitians, community health workers, places like the Maryland Living Well Center of Excellence, you know, so that they can connect their patients to resources. State agencies and local government, that's me, and lots of other members of the state government. The State Department of Health, all the local health departments, all have made diabetes a priority. That was part of the work behind the Diabetes Action Plan, is to clearly outline the impact and engage everyone to work together on this effort. Employers, there's a lot of sort of a variability in what employers offer, but employers are, you know, directing what health plans members have available to them. Many have wellness programs that do or don't offer special benefits for people with diabetes. I mentioned that so that you can check into that, ask your employers what they have, and know that we will be working on the other side to advocate for improved benefits for people with diabetes, because it pays off. Every dollar we spend helping manage diabetes well saves many more dollars in healthcare costs down the road. Payers or insurers, same way. The philanthropic community, also very engaged. Professional and advocacy organizations. I just had a conversation with the Physician Medical Society here in Maryland this week. They want to work with us. Community-based organizations, there are so many out there doing great work. And the schools, it's really important that we catch kids early. So this is ambitious. We're just getting started from my perspective, having just come into this role. But we will be pursuing all of these partners over the next few years. Next slide. This is out of the plan. It's a graphic from the plan, and it just shows kind of not only are we engaging a lot of partners, but we're working across the continuum. I think today we're mostly focused on the right side of the continuum, the diabetes and managing diabetes and diabetes with complications, and also for people who are at risk of diabetes, so the pre-diabetes circle there. But we will have activities across the full continuum, because we know that the further upstream we go, we can help prevent people from even getting into that pre-diabetes category. Next slide. I presented this slide at the last patient and family webinar. I just wanted to put it up again. To me, improving the lives of people with diabetes is all about marshaling all of your resources. As I said, I think these two websites are two examples. There are others out there. It's a great place to start. It's always there for you. We hope that we've offered information about lots of other resources that are here for you to access. But I think the main thing is that this is a lifelong disease, and there is support and information out there for you. Please keep looking for it, keep reaching out. Next slide. And that's it. We hope that you'll learn, hopes you'll gain some information today. We hope you'll look back at the other webinars, and we look forward to working with you on an ongoing basis as we all work to improve the lives of people with diabetes. This is my email address and my two team members, Dr. Sadie Peters and Lisa Marr. So thank you very much, and I will learn with you over the next few presentations.
Thank you so much, Anne. And again, we're so happy to have you on and in leadership in this important time. Next, I'm going to introduce Dr. Eva Singh. She is a general internist and assistant professor in the Division of General Medicine at the Johns Hopkins School of Medicine. Her research is focused on improving the health of patients with diabetes, with obesity and related conditions. And she is conducting intervention studies to improve the prevention of diabetes in primary care. So tremendously important work. Dr. Singh, welcome, and please unmute your mic.
Great. Thank you so much, Sue. So thank you for the opportunity to talk about ways we can prevent and manage diabetes. Next slide. I have no financial disclosures. So this picture depicts that there is a road or continuum to developing diabetes, and that we can stop diabetes by recognizing prediabetes early on. There are 3 tests that we use to diagnose prediabetes and diabetes, and they include the hemoglobin A1C test, a fasting blood sugar test, and a glucose tolerance test, which is where you drink a sweet drink and we check your glucose pre-drink and 2 hours after the drink. Next slide. So your doctor may screen you for prediabetes and diabetes based on a number of risk factors, including your race and ethnicity, family history of diabetes, and whether you are physically active. You may also need to be tested if you score high on the prediabetes risk test shown here, which is a test that you can take online and share the results with your doctor. Next slide. So prediabetes means a person's blood glucose is higher than normal, but not high enough to be diagnosed as diabetes. Prediabetes does increase your risk of type 2 diabetes and stroke and heart disease. However, if you have prediabetes, we can prevent type 2 diabetes. Next slide. So diabetes can be prevented by enrolling in a diabetes prevention program. This is a proven lifestyle change program that can prevent or delay type 2 diabetes. The program focuses on weight loss and increasing physical activity. And I'll talk about that in a little bit more detail in the next slide. And in some cases, your doctor may decide to start metformin. And we recommend that labs be retested at least once a year to make sure that you don't develop diabetes. If you recall from the picture on the first slide that the road to diabetes is 2-way, you can go from pre-diabetes to diabetes, but you can also go from pre-diabetes back to a normal blood glucose, and that is our goal. Some other considerations to think about is if you smoke, to consider quitting smoking and making sure your blood pressure is controlled, as both of these are risk factors for heart disease and stroke. Next slide. So the National Diabetes Prevention Program is a CDC-recognized structured lifestyle change program. To be eligible, you'd be age 18 or older, overweight or obese, have labs consistent with prediabetes or a history of prior gestational diabetes, or high risk based on prediabetes risk tests that I showed you earlier. These programs are conducted in person or online. They last 1 year in duration, so weekly for 6 months, and then 1 to 2 times per month for 6 months. It is an intensive program, but it can be very effective. Insurance coverage includes Medicare and Medicaid in Maryland, as well as some private insurers. On the next slide, there's a video of a participant talking about her experience in the diabetes prevention program.
I was overweight, making all the wrong choices, knew that I should be doing something, but I was overweight, making all the wrong choices, knew that I should be doing something, but I wasn't motivated to do so. I went to the doctor and I was diagnosed with prediabetes. I have high blood pressure, my A1C is high. My doctor advised me that I needed to make some changes in my life. I joined the class so that I can get support in the goal of losing weight, eating better, and also exercising more. I enjoy the class. We have a lot of laughs. I've learned that I need to be in a group setting because we support each other, we help each other, and everybody has a different perspective on the same situation, and we share information. Our class coach, Cynthia, is amazing. She's a very positive person. She is our cheerleader, if you will. She tells us that even though we make mistakes, they are not permanent, that we can learn from them and grow from them and maybe make different choices in the future. Against all odds, I've lost some weight. I have started to work out a little better. I've had more energy. I am walking more, and I am actually looking for other things to do to increase my physical activity along with eating better. I'm more conscious of what I need to do to take care of myself. It's not about how long you live, it's about how well you live. I prevent T2 for me so that I can live a long and healthy life.
Great, thank you. So for those of you with prediabetes, you can join the diabetes prevention program by referring yourself or being referred by your provider. A list of available programs are available on the Maryland Department of Health website. If you select that link, it'll take you to the page as displayed here, where you would select the diabetes prevention program, and then at the bottom, it would show which programs are available in enrolling patients. Next slide. Now, for those of you who have diabetes, you can still get your diabetes better and lower your blood glucose, and that's what I'm going to focus on next. So you've been diagnosed with diabetes. What are the important things to know? Well, our goal is to control your diabetes, but also prevent complications. So we'll check your A1C test at least once every 3 to 6 months, and we'll recommend an annual eye test and foot exam, as we know diabetes can affect both your vision and your feet. We'll check your cholesterol, your kidney function, and your urine for protein at least once a year. And in some people, they may need to monitor their blood glucose at home if they are on insulin or other medications. And we recommend visits with your primary care provider every 3 to 6 months for a routine checkup. Next slide. So there are important ways to treat and control diabetes, and they include modifying diet and losing weight and increasing exercise. And in some cases, medication may be started. There are also diabetes self-management education programs, as well as devices and technology that other speakers will be speaking about. Some other considerations include controlling your blood pressure, quitting smoking, and seeing a dentist regularly, as we know people with diabetes are more prone to gum disease. Next slide. Now, there are a number of medications used to treat diabetes, and these medications help your body make insulin or use insulin. And insulin is the hormone that controls the level of sugar in your blood. Sometimes your insurance may tell us which one your doctor can use. Now, these are the common medications we use listed here, although there are a few others that are less commonly used. Next slide. So just to talk briefly about a few of them, metformin works by reducing the amount of sugar your liver releases into the blood, and it also makes your body respond better to insulin. It's the first-line medication we use for diabetes. It comes as a pill. It is very affordable and has generally minimal side effects for most people. And researchers now are actually studying this medication in the fight against cancer, as well as other conditions like macular degeneration and even aging. Next slide. This is the newest group of medications called SGLT2 inhibitors. It works by decreasing the absorption of sugar in the kidneys and therefore lowering your blood glucose. It comes in a pill. Some of the common names you might see on the commercials these days are Jardiance, Invokana, and Farxiga. The coverage of these medications vary, although it's often a higher tier cost. There are some side effects, including a slight increased risk of urinary and genital infections, as well as dehydration, and may lower your blood pressure. However, there are some benefits of this medication, and that it may protect the heart and kidneys. So if you've ever had a heart attack or have chronic kidney disease, you should talk to your doctor about this medication. Next slide. So the GLP-1 receptor agonists are a group of medications that stimulate insulin release and delays the speed at which your stomach empties after eating, and therefore slows glucose absorption into the blood, and also makes you feel satisfied and more full after a meal. It's normally taken as a daily or once weekly injection, although recently it was approved as a pill form. Some of the common names include Victoza, Trulicity, and Byetta. And the coverage of these medication varies. It is often a higher tier cost as well. Some side effects include nausea, vomiting, and diarrhea. But because of the way the medication works, it has some benefits, including weight loss, and a few of the medications have been shown to protect the heart. Next slide. So now I want to discuss some other factors that may affect how you control or manage your diabetes. And these are things that sometimes people don't like to talk about, but are very important. We know that mental health problems such as untreated depression, stress and anxiety, or diabetes distress can affect diabetes. Here on the right side, I list some of the common symptoms of depression. People who are depressed might feel less motivated and eat an unhealthy diet or forget to check their blood glucose or take their medication. Next slide. So almost everyone feels frustrated or stressed from time to time, and dealing with diabetes can add to those feelings and make you feel overwhelmed. But there are ways you can cope. So make sure you pay attention to your feelings and talk to your healthcare provider about these feelings that you are having. And ask if help is available for the cost of diabetes medications and supplies, because we know that these medications can be very expensive, but there are ways that we can decrease the cost and make them more available. Talk to family and friends and other people with diabetes. In the next slide, I'm going to talk about the online diabetes community, which may be a good resource. And do one thing at a time. Whether it's taking medications regularly or focusing on your diet, we want to work with you to reach these goals. Next slide. So the Diabetes Online Community is a group of people with diabetes and their caregivers, healthcare providers, organizations who offer support and share knowledge to improve the lives and health of people with diabetes. You may find support, practical insights, share challenges, and find peers going through the same struggles as you. Next slide. So here is a listing of some large active community forums, advocacy organizations, blogs, online magazines, and news sources that may be helpful for you. So the takeaway points today are that the road to diabetes is two-way. For those with prediabetes, we can prevent you from developing diabetes through effective programs like the diabetes prevention programs. And for those living with diabetes, there are many resources and programs you can turn to, which other speakers will describe in more detail. And mental health problems can affect diabetes, so don't be afraid to speak up to your provider. And finally, there's a strong online diabetes community that can help us connect and feel supported through these uncertain times. Thank you.
Dr. Singh, thank you so much for that really important information, very meaningful and very attainable. I know we're going to do questions at the end, so I'm going to introduce, we have a team that's coming to you from Tidal Health, and it includes Dr. Catherine Fiddler, who's the current Vice President of Population Health for Tidal Health. She has the responsibility for hospital and community care management and coordination teams, she is also involved with community initiatives and the Richard A. Henson Research Institute. With her is Ms. Susan Cottingham. She's a registered licensed dietitian nutritionist and certified diabetes care and education specialist and the coordinator for nutrition and diabetes education at Tidal Health. And also joining them is Ms. Kelly Birch. She has had type 1 diabetes for 35 years. She is a certified diabetes educator and works with newly diagnosed patients, people with A1Cs of over 9, and patients with knowledge deficits. So please welcome our team, and you all unmute your mics and turn on your videos. Welcome.
Thanks, Sue. This is Catherine Fiddler. So Susan and Kelly are the folks doing the work for our teams, but I wanted to just introduce Tidal Health. So we are formerly just Peninsula Regional Medical Center, and now we have merged with Nanticoke Memorial Hospital, and as of 1 September, our Tidal Health, Nanticoke, Tidal Health, Peninsula Regional. So the staff you'll be listening to today is coming from our Peninsula Regional Hospital and talking about the services that we provide and how important a strong connection with our community members is. So without further ado, Susan and Kelly, if you two want to take it away.
Sure. Hello,
Right.
everyone. Susan, I think you're up first.
I am, yes. Well, welcome everybody. We're glad to have you here today for our informative webinar. And the speakers that have come before me have really laid the groundwork for what I'm going to talk about today. If you want to move to the next slide. So we're going to talk about the diabetes care team first, and that may be something you're not familiar with, a term that may be new, but everybody that has diabetes has a care team, and it includes different members. You have medical professionals that are going to be part of your team, friends, family, and coworkers that would be part of your team, community, and it could be people, groups, and they can be all part of your team, and then virtual, online, print media. So all those things may be resources for you, you know, people that you can lean on, that you can gain information from, knowledge and support. So we're going to talk a little bit about that. If you want to move to the next slide. All right, so at diabetes diagnosis, and that starts with your doctor, and we already learned a little bit about diagnosis of diabetes, but that may be from your primary care provider, which could be a doctor, a nurse practitioner, or a physician assistant. And the most important thing is for you to get educated. So you need to learn all you can about diabetes, how you can manage it, who can help you. And remember that you are the driver in diabetes management. So I've been in diabetes education for a while. And when I first started working in it, if you said to people, well, who manages your diabetes? Many times they would say, well, my doctor does. And that has really changed because you are the person that manages your diabetes. So you need all the information that you can to do that. So your provider gives you tools, may give you medication, may help you start testing your blood glucose, but you're the one that has to live with it every day. So getting the tools and the support that you need is really going to help you be successful in keeping your diabetes under control. So the first thing that may happen when you visit your primary care providers, they may recommend that you get some education. And those of us that are in diabetes education, nurses, pharmacists, dietitians, exercise physiologists, social workers. So we're encouraging people to get that education. And you can do that through a diabetes self-management education and support program. So those are offered all through the state at various medical centers, maybe county health departments, your local MAC center or senior center. So different programs are provided. There may be ones that are recognized with the American Diabetes Association or the Diabetes Care and Education Specialist Group or the Stanford Chronic Disease Management Program. So there are various types of programs, but they're all going to provide the support that you need and the education. Some of them may be 4 weeks in length, maybe 5, 6. It just depends on how it's set up. And many of them are in group. And so as the person that we saw the video saying that she learned well in a group, we have found that that really does help because you're getting information. You may think about diabetes in one way, but other people in the group think about it in a different way. And just those different nuances may help you in terms of making you succeed and giving you ideas of how you can do better. So look for a diabetes self-management education and support service. And then your provider may also recommend medical nutrition therapy. So that would be an individualized visit with a dietitian. And various insurances have benefits for that. But that may be an initial session with follow-up sessions, but it's just really individualizing nutrition for you, talking about how you eat, what you eat, changes that you want to make in terms of achieving a healthy weight or incorporating exercise, just eating healthy for other issues that you may have, whether it's heart disease or high blood pressure. So, that can encompass all those things. So that would be a good start to your care team. And if you could go to the next slide. So then your diabetes care team may expand and other health professionals included. We talked about the nurse and dietitian, but the pharmacist that may help you learn about your medications, especially when you go to the pharmacist or to the pharmacy to pick up what you need if you're on medications to control your diabetes. You may participate in an exercise program or cardiac rehab, and that could include an exercise physiologist, and then working with various people in the community in terms of social work or counselor or care manager to help with, social needs you may have, or just kind of dealing with the disease, getting support that you need financially or just assistance-wise. So there are a lot of people out there that can help, and just making those connections can help you be successful. The Certified Diabetes Care and Education Specialist is one of those people that you might meet as part of your care team. Kelly and I are both diabetes care and education specialists. So it just means that that person has worked in diabetes, has hours of experience, has passed a certification exam, and then stays up to date, through credits and learning. So it just gives that person a little bit more expertise and information to help, and knowledge to help work with people that have diabetes. So having one of those people on your team can be a plus along with everybody else. And then you may also be referred to a specialist. Unfortunately, diabetes does have complications. So keeping the A1C under control, reducing it to less than 7 can help minimize those complications. But at some point, you may have to be referred to a specialist to help you manage those conditions. And so we're really glad that they're out there, but it could be an endocrinologist if you're having trouble getting the blood sugar under control, a podiatrist for any kind of foot problem, psychiatrist or psychologist just for good mental health, a nephrologist if you have kidney concerns. Your ophthalmologist is really important. You want to have a yearly eye exam where they're looking at your retina, have that dilated eye exam. A neurologist may be helpful as well, a cardiologist for heart issues. And there are certainly others that would fall into specialists that you may need. So, talk to your primary care provider. Should you have any issues, there are lots of specialists that may be able to help you in the future. All right, next slide. So the other part of your team, aside from all the professionals, or everybody else that's around you, and that could be your family, friends, and your coworkers. It's certainly up to you to decide how you're going to tell people you have diabetes, how much you want them to know, how free you are to share. And we all know people around us that may make us feel uncomfortable at having a disease, or that if you tell them something, they're going to try to, maybe tell you what to do. So you kind of, again, have to be in the driver's seat to let them know, hey, I have diabetes, I'm learning about it, and I know what I can do. And ask them to support you. If you know how those family, friends, coworkers can help you, say, hey, can you do this for me? Hey, could you come walk with me? Hey, can you remind me? I've got to do this to help manage my diabetes. So they can all be a support because they're with you every day or throughout the week. And then community can also be a good support for you. So if you're regularly go to a place of worship, you are involved in clubs, different activities, those people around you, one, may need to know you have diabetes, especially if you're someone that takes diabetes medication that could lower your blood sugar, such as insulin, and you want them to be aware of symptoms of low blood sugar and be available to say, hey, you might want to check your blood sugar, or why don't you sit down, maybe you need to check your blood sugar. It sounds like it could be low. So just making them aware of what you have and what you experience so that they can be a support to you. We also have diabetes support groups, and those could be in person, although ours that we have here at Tidal Health Peninsula Regional, we've kind of put them on hold with COVID, but we do have a newsletter, and we're hoping to get a virtual event up for November, which is National Diabetes Month. So maybe at some point we'll be able to move back to in person, but right now we're just doing online and virtual. And there are support groups out there through the Diabetes Association, some of the resources that were shown earlier, so that if you wanted to do things online, there are many bloggers out there for diabetes, but do just be careful because sometimes they're not necessarily giving the correct information about diabetes. And that's why I would recommend, having one of those diabetes support and education programs where you're going to learn the basic diabetes management. And remember that diabetes is an individual disease. Some people do things a little differently, or they may find that different things work. That doesn't mean it's good for everybody. So you always have to think about what the basic guidelines are and then go from there. And then we also know that print media, magazines, newsletters, online options can all be a support. Many people like to read. They like that magazine that they get once a month. So if that's something that provides support to you, there's some great publications out there. The American Diabetes Association has the Diabetes Forecast magazine. And then there's also Diabetic Living magazine, which is a really good resource. And both of those, you can get them in the mail or online, but they have good articles about people living with diabetes, recipes, just neat facts that just help in as far as ongoing diabetes management. And then pharmaceutical and diabetes supply companies. Now, we wouldn't necessarily think of them as part of our team. However, if you have a blood glucose meter, if you have a CGM, if you take medication, go to the websites of those companies, because many times they have diabetes resources and education that you can plug into. So it's just a resource that's out there and not always taken advantage of like it could be. All right, next slide. All right, so remember that diabetes care team is your source of education, learning what you can do, what you should do, how to go about doing it. But it can also be a motivator for you, as well as other people in your life, that care team. You can get direction from your care team, inspiration, and many times that comes from people around you, support group, family, friends, as they can motivate you. And make sure you surround yourself with people that are encouraging. If you have those people in your life that may be discouraging, figure out a way to work with them, get them on your team, so that they can move you in the right direction. So all these things are going to help you in your journey through diabetes, because once you have diabetes, unfortunately, we can't get rid of it. We can control it, but it's not going to go away. All the things you do to change, or the changes that you make to improve your diabetes, if you stop doing those, your diabetes is or your blood sugar is going to go higher. So it's just a journey through life, and you need to have that care team encouraging and supporting you and motivating you. So I'm going to turn the program over to Kelly.
Okay, so next slide. All right, so I look back and I think about my patients, and of course I think about myself as well, because still a person with diabetes. So sometimes I wish these things maybe I talked to my care team about when I was diagnosed. But the 5 things that I really wish my patient had told me, when we met, and this is just a quick little slide, and I'll go in more detail, but finances, diabetes is expensive. Medications are expensive. If you have insurance, they're still sometimes very expensive. People tell me all the time about their healthy eating. That is a financial concern. Why do you care? Maybe that should be, what is your motivation? But, why do you care? Why do you want to be healthy, with diabetes? Those emotions, I think we've all touched on that a little bit. There are definitely emotions that go along with having a diagnosis of diabetes. Your support system, and I believe Susan has really touched on that, that you do have a support system when you have diabetes. And then the other health issues that sometimes can accompany, having diabetes. Next slide. So many times my patients will say, I can't afford my medications. So that's a big deal because it's hard to manage your diabetes if you can't afford it. So there are patient assistance programs out there. A lot of them will work with patients. It depends on income. There are cheaper options for insulin. And I know that hopefully, I'm really hoping that we're going to really get a handle on some of those insulin prices coming in soon. I know that, they're trying to get a cap for $35 for Medicare patients for their insulin. And right this moment, there is special COVID-19 pricing available, which is really kind of a nice thing. Not that we needed a pandemic to get special pricing, but those things are available. So just knowing that, that my patient couldn't afford them, and it's not always about insulin, it's the other meds as well. But, we're here and we're a resource. We don't have the medications to give anyone, but we are a resource and we can help them find where they need to go, and also we talk about the MAC Center because I know that they can help patients, with medications. So just so you got, there are places out there to get some help, if you can't afford medication. So it's nice to know that. What if you say, I can't afford my testing supplies? And many times a patient will tell me, oh my gosh, when I go buy a bottle of test strips, they're $85. And it's like, I can't afford that every month. Well, there's less expensive meters out there with their test strips and the Lancets. Different pharmacies have different meters and some of them are less expensive. And they do all have to follow the guidelines of not being off by over 20%. That's every meter out there. Sometimes you're prescribed a meter that isn't covered under your insurance. So make sure that the meter that you have is the one that your insurance will actually cover. And believe it or not, there's patient assistance programs with those as well. I heard Susan mention CGM earlier, which is your continuous glucose monitoring systems, like Dexcom or Freestyle Libre or even the Eversense. And then also the Guardian from Medtronic. So there's lots of, great CGM companies out there, but believe it or not, they're offering patient assistance programs as well. So getting online, like Susan said, and going and checking into things like that is definitely a great tool. I can't afford healthy food. People tell me that often, it just costs so much more to have diabetes because I can't afford the healthy food. Well, first of all, let's look at the foods we buy. Okay. I mean, I'm as guilty as everyone else, and I'm not going to call it guilt. A bag of potato chips cost about $3, but so does a 5-pound bag of potatoes. So we kind of have to maybe look at what's in our pantry, and see what we get, what we're paying for and what we're getting for the money. And I always think, we talk about food pantries, even Meals on Wheels, and I think they're wonderful resources. Sometimes it's not always the easiest to find, the healthiest fruits and vegetables may be there, but, some are there. And then what's in season? Like right now, apples, right? Apples are going to be a reasonable cost. I believe, is it broccoli that's going on right now? So what we want to do is, kind of think about what's in season, what are some better choices? And even like Susan had said, talking to a dietitian, because they are very wise and they can let you know where to go and access some of those things and where you can find it maybe a little less expensive, but there's still healthy options. Next slide. So how about emotions? They say that people with diabetes go through the same emotions as someone, dealing with grief. And I believe that's true because, we may not be the same, and many times people will say, I feel fine. If they're newly diagnosed with diabetes and their A1C is under 7 or maybe even in the 7s, they don't feel bad, That's why I think people call this the silent disease, because you really don't feel bad. I remember being diagnosed and I just kind of ignored it. Not that I didn't take my insulin, because I did, But I know I went through a good 5-7 years of denial, like, really, this is not happening. Anger, why me, right? I want to blame somebody, darn it, why me? Why do I have this? I thought that for many years. Who's to blame? No one's to blame, not even yourself. Bargaining, I'll do anything for more years without diabetes or for more years without taking insulin. We want to bargain. Depression, I'm so sad. Why bother with anything? What's the point? Been there. I've been there through my struggle with diabetes. However, I'm at this place of acceptance. I can't fight it anymore. I might as well prepare to live healthy with diabetes. And that's a great statement, but we're not all there. Some people I have talked to over the years, I've had embarrassment, like I had a 16-year-old girl who was newly diagnosed with type 2. She felt embarrassed. She felt as though it was all her fault. Yes, she was overweight. However, I asked her, I said, well, your mother has type 2 diabetes. Is that your fault? No, that's not her fault. So there's one risk factor. Her mom had gestational diabetes when she was pregnant with her. Is that her fault? No, again, another risk factor. So embarrassment, shame, guilt. So there are so many emotions, even sadness or fear. People will say, well, my grandmother lost their leg when they started insulin, so they have a fear of even insulin. So, there's a lot of emotions. So we need to have some help with that as well. But I wish, like I said, patients had come to me and said, oh, this is how I feel. And it's hard for us to express our emotions. So getting some of that behavioral health is definitely an amazing thing to help somebody with diabetes. Next slide. Why do you care? Or what's your motivation, right? So is it your family? Could be your children, right? Your spouse, your significant other, your parents, or even extended family. What is your big why? Or what is your motivation? What is your motivation? Big events in life. Do you want to be here long enough to see your youngest daughter get married? Do you want to see your grandchild graduate from high school? You just want to be here for others as long as possible. These are big deals. And maybe your motivation is to prevent the other things that could happen. Blindness, heart disease, kidney disease. So I think what we need to do as people that are working with people with diabetes is really find out why. Why do you care? What's going to motivate you? And how can I help you get where you want to be? How can I help you set those goals? Next slide. Other health issues, right? Heart disease, kidney disease, nerve damage, blindness, stroke, erectile dysfunction. Some of these health issues make it harder to manage your diabetes. So if you're losing your sight, for example, you might need a different type of glucose meter. They do have some that talk. They're still not the greatest thing out there, but we have Blind Industries that's available to help with that. So again, sometimes it's bringing in other community programs that are out there. If there are kidney problems, you might not be able to drink the extra water to lower your blood sugar. We know that drinking water will help, lower the blood sugar, but if you have a kidney issue, they might have you on a fluid restriction. If you have nerve damage, exercise is limited if you can't feel your feet. You have to make sure you're walking on solid ground. Discuss medications to help with the above issues. Even erectile dysfunction, meds that are available. People are sometimes very embarrassed to talk about some of their problems, but know that, your diabetes educators and your community educators, we are out here to help you solve some of these problems with your other health issues as well. Next slide. So support system, again, Susan really did a great job with that. Sometimes a person with diabetes may feel alone, especially if they don't have friends or family nearby. I had a patient this morning. She said, I have a caregiver, but she didn't have friends or family. So it's important to remember support can come from others with diabetes. Again, your medical professionals, your community. I think we have amazing things in our community, virtually, online, and print media, like we've already discussed today. We do have our local support group at Tidal Health Peninsula Regional. It's on hold due to COVID. I am sending out newsletters, so if anybody would like to receive a newsletter, I'm not sure how I could get everyone's email, but I would be more than happy to send out our, our newsletter. Working diligently right now on a virtual diabetes awareness event being planned for November. As Susan had said, November is Diabetes Awareness Month, and every year we have an amazing program. We have our local doctor who comes in and speaks, and we also have exhibitors, people that want to talk about different insulin pumps or CGMs or whatever's available. So this is a big deal, but I'm sure there's all those things in every area in Maryland. Sometimes we have to look for things though. We have to be proactive, and we really have to get out there, and we have to look and find what some of the other support systems are. So I believe that is the last of my slide, but yep, that was it. Just wanted to make sure. So we really thank you for your time, and we really hope we've made a difference in someone's lives. Thank you.
Oh, thank you so much, Kelly and Susan and Catherine. Really important, very concrete information. Again, that just the resources that all of you today have so far mentioned, really important for people. I want to move us to the next presenter. This is Ms. Kelly Kessler. She is the director of the Howard County Local Health Improvement Coalition at Howard County Health Department. She provides leadership and facilitation for over 130 coalition member organizations who are really working on access to care, healthy aging, behavioral health, healthy weight initiatives, all of these things. So more resources, more tools for you. Kelly, take it away.
Hi, thank you. I hope everybody can hear me okay. If you want to just advance to the next slide, I wanted to just touch base today and kind of follow up about the conversation about resources. And I know that folks are from all over the state on this call, and so I wanted to talk a little bit about Local Health Improvement Coalition, and I'll focus certainly on our community in Howard County, but many of these things apply to other areas in the state. And I wanted to talk a little bit about the programs and also access to other services that are available in our community and other communities that support chronic disease self-management. Next slide, please. So just a little bit of information for everyone. I know many people are not familiar with local health improvement coalitions and may not necessarily be familiar with the state health improvement plan. But in Maryland, all of our local health departments are required to have a health improvement process. So we, like anyone, we look at certain metrics and measures that are sort of, I tend to refer to this as our health report card for the state. But Maryland looks at specific measures in 5 focus areas that sort of represent what our health looks like as a state. And the state health improvement process resulted in the creation of local coalitions to look at areas where improvements are needed and areas where we have known health disparity. And I'll just kind of highlight, and I think many of you have probably heard in the news of recent, some of the disparity that's been identified as a result of the COVID-19 pandemic response. Our coalitions have been charged with looking at health disparity prior to COVID, but certainly now with COVID, we're looking at that as well. But it's really important that we're using data to drive action, to make sure that we're addressing needs and addressing communities with need, so that our vulnerable communities have access to programs and services that others may as well. Next slide, please. So all of the local health improvement coalitions across the state range and vary. Some are managed through local health departments, some are in partnership with their local health department, but may be managed by a nonprofit. If you are in some of our rural areas of the state on the western part, or specifically on the eastern shore and southern Maryland, you may have tri-county partnerships that make up your coalition. But these coalitions are intentional ways to pull together variety of community members to address programs. And I want to use this as a real plug in terms of things that you can do. As a community member, there is always a need and always a space at the table for your participation and your feedback in these coalitions. And so, if you're looking at like, how can I get involved now that I'm experiencing this, or I want to do something to help others, your coalition may be an avenue that you want to consider. We bring together government agencies, we bring together local businesses, community members, faith-based organization, nonprofit organizations, American Diabetes Association, American Heart Association, the Lung Association. We work with other types of programs, AFSP around suicide prevention, and many other groups as well. Next slide, please. In Howard County, our coalition identified our vision and our mission. And so I just want to reinforce here what I have mentioned before, that our vision is that everyone in our county will have access to healthcare and health outcomes will be equitable for all. And so what that really means is that we're removing barriers and we're making sure that folks have access to programs and services that they need. And that supports our mission to achieve health equity and to identify and reduce health disparities in our community. Next slide. So what was mentioned previously around accessing services, we fundamentally believe and value, as I would step out on a limb and speak for many of the coalitions across the state in your communities, that health is really, your health, it can be determinant on many other social factors, things that don't necessarily have what people might automatically, affiliate with health. For example, if you don't have transportation to your healthcare and you don't have housing, or you don't have education, and perhaps health literacy is a very genuine concern for many folks, understanding the information that's presented to them. If you don't have access to employment, you may not have access to insurance. You may have to look for other resources. If you don't have food security, we recognize very much that all of those social determinants have a great impact on health. And so when we look at the programs and services that we offer for individuals with diabetes, with other chronic conditions in our community, whether we let's take the same approach looking at opioid addiction, for example, we look at these factors and we try to make sure that we're addressing them through all of our programs and services. Next slide, please. So our coalition, like every coalition, is tasked with identifying what our plan and our strategic plan is. And so just to give you an idea of our coalition, we had 4 main priority areas, but I'm going to focus on the access to care priority. Our state health improvement process measure looked at emergency department visits for diabetes, hypertension, and asthma. In Howard County, we had a known disparity, a recognized disparity based on data to drive our action, that we were seeing far more African-American residents in our emergency department for diabetes and for hypertension. And so our coalition really wanted to look at, what are we doing to address that? How are we preventing people from being seen in the emergency department for diabetes so that they are not finding themselves in that emergent situation? Next slide, please. So in our community, we had a variety of partners, as I'm sure in your communities you all do. Some are sponsors of the program today, in fact. Our Office on Aging through our Department of Community Resources and Services, our local hospital through Howard County General Hospital, and some independent providers and individuals were really looking at chronic disease. And much like many communities, sometimes we work in silos unintentionally, but we all are sort of tasked with our work. And what we really felt like we needed to do in Howard County was, before we started just adding more and more programs, we really needed to look at what did we have and how was it working. And so we brought it all together, and in our community, we developed an MOU between our organizations, and we hold regular work group meetings, and each one of us kind of offers a different perspective. And through the coalition, we really are looking at and owning the responsibility for that data and helping that data kind of drive the action that we're taking on. But we really wanted to make sure that we were working with our coalition to identify community partners who wanted to be leaders. For example, faith-based communities. We've now trained many of our faith-based community members who want to offer programs through their own churches. And so that has been really helpful in helping us reach populations. And I think that it kind of stems forward to what everything is going on in Maryland around the Diabetes Action Plan, and what we're trying to do to help individuals living with diabetes is, if you want to go fast, go alone. If you want to go far, go together. It takes a lot of work to do these things. And so sometimes you can't expect immediate results to happen overnight. And I think that is something that we have seen in our programs and the way we address it in our community. Next slide, please. this again just sort of highlights some of our partnerships. We have been very fortunate in also having support from the Maryland Living Well Center of Excellence, and we're going to talk about especially our chronic disease self-management efforts here in the next slide. So in Howard County and in the state, I know previous presenters has talked about other programs that are available. We do not have a diabetes prevention program, the national DPP program that is offering. There are a few individual providers, but the health department, the hospital, and our Office on Aging currently are not providing this program. But this is an available program, and I think is certainly something very worthwhile, because it goes back to exactly what I said before, is you can't expect change to happen overnight, and these changes do need to take long-lasting effects. So this program, as previously mentioned, runs for over a year. In the next slide, if you can advance for me, in Howard County, we prioritized chronic disease self-management suite of programs. And this was really based on decisions made on how our community has looked at programs and how we were trying to address chronic disease in multiple areas. And so we really felt like the suite of programs that were available there was something that we could really obtain a lot of buy-in from our partners. And these programs teach self-management of chronic conditions. They also address other priorities, again, that the Health Improvement Coalition was looking at, things like fall prevention, even looking at addressing addiction when we talk about chronic pain management, and try how we can use these prevention strategies to address the opioid epidemic. So I did share here, and I'm sure it'll be shared in the chat. You can find classes in Maryland by looking at the mdlivingwell.org site, and it's a wonderful site with lots of great resources. But something that we did in Howard County, I mentioned sort of silos. We also really looked at how do we present the programs to the community. And so I'm sure many of you have experienced that sometimes you're looking for a program or a service and it's difficult to find. So what we did, and the way we've approached it, is we have one number that you call and one website that you go to register. And so whether the class is being offered by our Office on Aging or the class is being offered by our hospital, you can call the Office on Aging to speak to a human and to have questions answered, and you can register for the program through the hospital's website, and that makes it much easier. And we really share our facilitators in helping to recruit and to train them as well. Next slide, please. So our suite of programs in Howard County, and many of these programs exist in your communities as well, include the Chronic Disease Self-Management Program, Living Well, and we do offer it in a variety of languages. We also offer the Living Well with Diabetes, which is very similar to the Living Well program in terms of its content, but it really focuses specifically on those living with diabetes. We also offer Living Well with Hypertension, and I mentioned Living Well with chronic pain. We recognize that many of these things go hand in hand, and just as I mentioned before, the social determinants of health, that there's so many factors that impact someone's health. All of our programs that are offered connect people to other resources for care. Additionally, we offer self-management education through Stepping On, Stepping Up Your Nutrition, Powerful Tools for Caregivers, and then we also offer the Cancer Self-Management class. Next slide, please. So a little more detail about the Chronic Disease Self-Management Education is a 6-week workshop, and it really covers a variety of modules. So you learn about nutrition and healthy eating, you learn about exercise and ways to maintain your physical health, and we are very sensitive to the fact of, you know, how you can be physically active. Some people may have other underlying conditions, and what's great is that there is a mutual feeling back and forth. So if you learn through this that maybe you are at risk for falls, we're also then able to connect people to our fall prevention programs. Communicating effectively with family, friends, and providers. Previous speakers had talked a lot about fear and some of the other factors that go into that and how you communicate. And so having an opportunity and a space to really talk about those things is something important and featured through this program. And then techniques to deal with pain, fatigue, ways to make informed treatment decisions, developing skills for problem solving, everyday challenges, and then action planning and goal setting. They're all included over the course of this 6-week program. Next slide. With diabetes, it's very similar, as I mentioned, but we add in the discussion about glucose monitoring, healthy eating, and preventing low blood sugar, preventing or dealing with complications specific to diabetes. And some of those things were discussed. You talk about vision, you may talk about, some of the sensation, things of that nature. Medication usage, again, exercise and maintaining balance of blood sugar, and then skin and foot care. Next slide. I'm not going to spend too much time on this, but Living Well with Hypertension is a one-time session, and we offer this kind of as an introductory class to 6-week workshops. And this really focuses on a lot of the same topics, but focuses on high blood pressure. And again, we recognize that often these things go hand in hand. So we're trying to wrap around our care and our education to accomplish overall wellness for our community. Next slide. And I mentioned Living Well with Chronic Pain. It's a very similar layout and many of the topics overlap, but I think that this is a really important piece to feature, just knowing that our state is, in fact, like many, involved in fighting the opioid epidemic. Managing chronic pain is something that is very critical in that fight, and learning how to manage pain can also remove barriers to physical activity, which is so critical in maintaining your wellness. Next slide. So I wanted to just give a shout out to my colleagues, specifically Nicole Becerra, Tara Butler, and Wendy Farthing. I mentioned our community partnership, and I feel very fortunate in Howard County that our partnerships really are, as I mentioned, starting to wrap around our arms on our community. And anyone in our community that's been diagnosed with chronic disease, especially with diabetes, or have been told that they're pre-diabetic, we as these organizations through the health department, our coalition, the Office on Aging, the hospital, and the Living Well Center of Excellence really are truly working collaboratively to wrap our arms around all of our community members and try to help connect them with the care and support that they need to manage their condition. Next slide. So I really encourage you, I put my contact information, and you could certainly connect with Howard County's LHIC if you are part of our community. But if you're interested in finding out more about your community, I really encourage you to think about this. The previous Kelly that spoke also mentioned talking about sort of what is your why and what is your motivation, and learning about things in terms of, trying to prevent additional health consequences or trying to prevent others from getting it. And I think your local health improvement coalitions will offer you a space to think about how you can get involved in supporting your wellness, whether you're looking for physical activity, you're looking for nutrition programs, you're looking to be connected with other people, or maybe you really want to engage around preventing this from happening to others. There are lots of opportunities to engage, and sometimes that helps speak to somebody's why. And so I just invite you to consider that, and certainly, welcome you to reach out if you'd like to talk about, finding out about your community's LHIC. And that's sort of all I have.
Well, Kelly, thank you so much. What, again, wonderful resources. In fact, we do have someone who just posted in the Q&A that they'd like to join a Living Well with Diabetes class. So that's absolutely wonderful that you've been able to share this information, and we can make sure folks get connected. So we're sort of running short on time, but I do want to introduce our last speaker. Ms. Leanne Eagle is the Executive Director of the Maryland Living Well Center of Excellence at MAC, and she works closely with the Maryland Department of Aging and the Department of Health on programming around all of these programs, just as Kelly was mentioning. So I want you to continue to put questions in the Q&A. I know we've had folks who are answering a lot of those offline, but please continue to do that. And Leanne, I'll turn it over to you. Please unmute your line.
Thank you, Sue. And I want to thank all of these wonderful people that have presented before me. You all are all of our partners. We know it takes the whole team, and it takes the whole village, and especially during this time of COVID-19, we've been challenged to bridge this virtual divide, right? Like getting everybody connected with resources and tablets and phones, and how are we going to make this happen, and how are we going to teach people to use these tablets and phones? Next slide. We want to be able to, the important thing during this time is linking these older adults and people with disabilities to needed services during my COVID-19. A short story to tell is we were offering a diabetes self-management class during COVID-19 at the end, and we had a young, she was in her mid-50s that came to class, and she said, I was just diagnosed with my diabetes, and I don't have any money. I don't have a way to get my insulin. I don't know how to test myself. So us being able to call that PCP office, and here in Salisbury with our wonderful partnership with Tidal Health and Catherine Filler's team, we were able to reach a Maryland primary care practice, and that case manager came over and taught that woman how to test. That was fabulous. Like, that is a true circle. That is a complete circle. So I always want to highlight that. It's a huge success. But most of the requested services during this time have been home delivered meals and shelf stable meals, because we saw a lot of people that have that fear is they didn't want to go out, or they didn't have the financial type of resources to get these kind of meals. Transportation was another big issue. Accessing, like we did the state of Maryland a command center, and with that, those phone calls that came in from 211 highlighted to us these people were extremely frustrated. They did not know how to use my telehealth. They could not get connected to the telehealth because they did not have a 5G network. And if they did have a 5G network, they had no idea on how to use it. So that was just some of the things that were coming through to us with this command center. The other big thing was depression. During this time, we had also created a tool called Users, which was an upstream screener for social isolation. So by us doing this screener, it told us these people did not know why they were feeling the way they were. And when we did the screener, they thanked us because they said, thank you. We didn't know why we were feeling that way. So that was a very aha moment for us. We also, was the diabetes chronic disease self-management. We are now able to offer these classes, virtual workshops. And that is going to be a beautiful thing as people can get connected and do it remotely during this time, and probably even beyond this time. I don't see it going backwards. Next slide. Here's some of the key strategies to survive in the new post of this COVID-19 world. We will need IT connectivity more than ever before. So the Maryland Living Well Center of Excellence and Eagle Force developed an educational platform for these participants without computer or Wi-Fi access. We have tablets that are equipped with unlimited talks, data, and text for 2 years. They first were just coming out with the Team Mobile on them, and I said, the Eastern Shore, that's not going to work. We need Verizon. So we were able to get these with that Verizon chips so we can reach those remote areas of Marion Station and Crisfield with our partner here on the Eastern Shore, our main partner of Tidal Health. We knew we needed to reach those clients in their service areas. So we were very cognizant to make sure that we had that kind of bandwidth. The tablets are preloaded with the MimiRx, which is where someone can put in their health information with a telehealth platform. They have Zoom on them so they can get connected to these classes, like Kelly said. They can connect to chronic pain classes. They can connect with their diabetes self-management classes. they can get connected. And we have created a lending library. We will have 30 as of tomorrow. And we will be creating a lending library with these, where these people can get engaged in these classes when they still can't get out. These agencies will have access to a call center to support for their tech needs. So we have a 24-hour person they can call if they can't get onto their telehealth, or if they need help getting onto Zoom. We've tried to make these as simple as possible. We've also been able to put our data collection forms. Kelly talked about screening for social determinants of health. We also have all the pre and the post surveys, because right now we have a struggle bus trying to get all of that information back that we need for these classes. So they will be embedded in this. We will also have the ability, if someone has their own device, to be able to put this kind of platform on their device so they can do it in an easier way. So we're very happy to launch this probably as of next week. We're in the midst of creating a lending of a library kind of contract type of thing. We are also able to turn off the device at any time. So say if they've missed, say, the second class and they haven't given us a reason why, we can cut off the device. So hopefully that will give them more of an incentive to take part. Next slide. Here is what they are preloaded with. We call this the MimiRx 8-inch tablet. They are loaded with the telehealth. They're loaded with interoperability and the connectivity. They have unlimited talks, text, and data, because we know part of the reason why is these people also have not been able to be connected with their families. They've not been able to be connected with their physician's offices or whatever it may be. We're hoping that this will enable that digital divide to be smaller. Next slide. Here is a picture of what these devices look like. And it's just the opportunity for people with diabetes to work with their providers for IT access. Next slide. And here's some, if the physician wants to write an order, they can get these other remote monitoring for my diabetes, cardiovascular disease, asthma, COPD, COVID-19. And the beauty about this is they are already, the Eagle Force technology is already being used with Morehouse down in Georgia. They were the grantee that was chosen to work with my disparities. So they have already launched this down there as well. And they did this around 100 Black men. So they're really trying to get to really broaden this and to make it a very big opportunity to get this pushed out to even more people. Next slide. Here's just what the Galaxy Tab A is, what it looks like. And here's just all about what it has a front camera, power button. It's just very self-explanatory because we wanted to make this as simple as possible. It's put in a hard case. It has a knob on the back, so in case there's someone that has arthritis, it's easy for them to hold on to. Next slide. Here is just a slide which explains the MimiRx community-based programs. This is where we have the screening tools. This is where we have the Pearls program is embedded in here. This is where we have chronic care management in here. The screening tools for social determinants of health and isolation. because we think it's very important, because even if you look into a PEARLS program, for instance, we had an individual who had a housing issue, which is a social determinants of health issue. At the time, they were screening depressed. When we were able to eliminate the housing as an issue, that person no longer needed PEARLS. So I think doing any of these programs without including social determinants of health and isolation at this point is very important, because if we can eliminate some of those issues, they may find it's easier to control their diabetes. Next slide. And here is just some of the MimiRx systems that feature the CHWs. We have really tapped the CHWs is our work, like that's where we get our workers. So that is where we have them log in. We know exactly how much time they're spending with that patient. We know exactly what the outcomes are, and able to bi-directionally data share. Next slide. And here is just the MimiRx training material. These are the materials that we use to train this, the CHWs into this my system. Next slide. So that is basically the information on how we have chosen to use technology with the evidence-based programs so that we can actually start to bridge the virtual divide.
That's great. Thank you so much, Leanne. And thanks to all of our presenters. We do still have a few minutes, and I will encourage you to share things in the Q&A or to go into the participants, raise your hand, and we can unmute your line. I know we've answered a great number of questions already. I would love for our presenters to open their mics and turn on their videos so that they can begin to participate with you. And we've had such excellent speakers. I do want to open this in case any of you want to share some additional information that will help the individuals who are attending today. Dr. Singh, I think you've been answering a lot of emails. I saw one on metformin, some on exercise and nutrition. Do you have some additional information you'd like to share with the group?
Well, there's definitely a lot of information that can be presented about medications. I didn't go into it in too much detail, although certainly could go into it if there's more specific questions from any of the participants.
I'm still looking, and I haven't seen anyone pop up. I know people have shared some of the challenges that they've had and their interest really in learning more. And other things that you'd like to say as we near the end?
No, I'd just like to go back to something Kelly said. I really appreciate the mentioning the LHIC, the Local Health Improvement Coalition. We're actually working, there's an LHIC serving every county and the city and Baltimore City. And they will be continuing to expand their diabetes related activities. And it's great to encourage you to be at that table with all the partners there and help shape what they do. So thanks.
That's great. Catherine, Dr. Fiedler, anything that you want to add at the end here? Thanks so much for bringing your team and all of that wonderful information as well.
I think it's just so important. There are a lot of resources, and I think we all, the leaders of these resources, know them very well. And I don't know that we always do a great job communicating to our individual communities or the state of Maryland what we're doing. So I'm excited that many people have had the chance to hear this. I'm definitely, oftentimes you can just reach out to a healthcare organization, your health department, and just call and ask a question, and we can help connect you. There's a lot of willing people. And Kelly, you mentioned, I think it was so important, we need community participation on these activities. And now in the Zoom world, there's probably better ways. And you don't have to leave your house necessarily and can still participate. So community involvement is key. We make assumptions about what individuals might need, and having the individuals needing that help on board is the way we're going to make a difference.
That's great. That's absolutely wonderful. Kelly Kessler, more that you want to join in and share? I know you had just tremendous information, and thanks so much for going through the evidence-based programs and all of your partnerships. But other thoughts at the very end here?
No, just thank you so much for including us. And, and again, I mean, I think it's a great way for folks to get involved. I mean, as someone who has lived with various chronic conditions, being able to do something positive out of something that many people can feel it lands on them very negatively or can be very hard is really empowering. So I just really encourage families, caregivers, patients to kind of think about that and like really think about how you might want to get involved. And it can be anything from, helping prevent obesity in our kids, or, encourage physical activity in kids, to encouraging physical activity with people who, just need to, maybe even just starting to move more. It can take anything from being part of a coalition to simple small actions, but doing that is a really empowering thing that improves your overall wellness as a whole.
Terrific. I do want to remind all of you that there is a brief survey at the end. Please do complete it. What's important is there are some questions about what is it you're missing, what else do you need, what else can we do as we go through this 5-year journey to really begin to dramatically impact diabetes and improve the lives and quality of life of the residents of Maryland. Any further thoughts?
I would just like to take this opportunity and thank Sue for being such a wonderful organizer of all these MDH diabetes webinars. You've done an amazing job. Thank you.
We've had a lot of fun. We really have had a lot of fun, and so many people who have volunteered to share their information, their expertise. And I know that you all who've attended today really value that. So as you complete that post survey, we will be sending out links to the recordings. Even though we have the 8 of them, and 5 of them are really focused on clinicians and on community health workers and direct providers, and 3 then that are for participants, you can access all of them. You can watch and listen to all of them, and there's different and impactful information on every single one of them. So please join us, and I hope that presenters and others will share these as good resources for your clients and for your organization as well. So thank you all so much for joining us today. Don't forget to do the survey, and you'll be hearing from us. Take care, everybody.
Bye-bye.
Thank you.
Thank you.